Hey, madam.
I haven't entered it. You connect. I haven't entered it.
Yeah. You.
That's what will be Mr. Yoga.
Welcome back. Okay, so the fetus looks edema.
Who is that? Who is that?
And there's a lot of fetal anemia. So the fetus is pale, the placenta is pale. You would look at the red blood cells and you see that they are attempting the bone marrow. There's compensation or attempt to produce red blood cells. We call that compensatory hyperplasia. So there's compensatory hyperplasia of the bone marrow in an attempt to produce a lot of red blood cells. Because there has been a breakdown of the red blood cells and there's anemia, the bone marrow is called into action to produce a lot of red cell precursors. And when you look at because of the increased production of red blood cells, if you look at the blood, you see a lot of immature red blood cells. And this is what gave the name erythroblastosis fetalis, because the immature red blood cells are erythroblasts. So you see a lot of immature red blood cells in the blood of the baby. And that's why it's called erythroblastosis fetalis. So usually they also have high levels of bilirubin, usually above 340 micromole per deciliter. And this is what leads to damage to the central nervous system, condition we call kernicterus. Because the bilirubin is deposited in the basal ganglia in the brain. And this leads to abnormalities in movement and posture of the baby. Adults are protected from this effect of hyperbilirubinemia because we have a blood-brain barrier, which prevents substances from the brain, from the blood from getting into the brain. But in infants, that blood-brain barrier is poorly developed, and so they are prone to developing kernicterus or brain damage. So this is a post-mortem sample of a specimen of a brain with kernicterus. You see there are yellowish deposits in the brain, and the points where the arrow is pointing to are the basal ganglia with the deposition of bilirubin in the brain. Okay. So treatment is by making sure that the mother is given anti-D. You can also do antenatal exchange transfusion in utero, but that's not available in Ghana here. Then also phototherapy to the baby who has the jaundice to prevent brain damage by breaking down the bilirubin. So, any questions? Are there any questions?
Hello, Ghanaians. Any questions?
Hello, Ghanaians will be coming to our doorsteps very soon.
At
9:30. Any questions?
Hello, Ghanaians. Any questions?
Yes.
I come to your homes once again.
I will knock you down.
So, madam, I have a question.
Yes, please.
I thought as ma.
Let's ask a question.
Madam, the ABO, the ABO incompatibility. Madam, you said it causes anemia. Is it sickle cell anemia or normal anemia?
Normal anemia. The anemia is from breakdown of the existing red blood cells. Anemia, what is anemia? Anemia is a decrease in the oxygen carrying capacity of the blood as a result of decrease in the hemoglobin. So sickle cell is not the only thing that can cause anemia.
Who is that? Who is that? Are we in the market square?
Elisha,
Hello,
are you okay?
madam. I have a question.
Hey,
Okay.
Yes, madam, I'm okay.
Um,
All right.
with the IUGR, intrauterine growth restrictions, with the causes, I noticed both the maternal causes and the placental barrier causes. I was expecting to see perhaps a cause related to administration of drug or something. Does that mean there is no drug? Like does that mean there is no drug that can be administered that might in the long run cause IUGR in pregnancy at any point in time?
Oh, there was narcotic abuse, alcohol abuse.
I'm saying this because of an episode I witnessed.
Oh, it is there. There are
Yes,
medications.
the lady had her first pregnancy all right. But with the first pregnancy, she had very severe hyperemesis gravidarum, which was controlled and it was okay. She had the baby, but because it was that bad, during her second pregnancy, she was given Avomin, Vomitin, for some time throughout the first trimester until the symptoms subsided and the pregnancy continued. But by the 5th month, it was detected she had developed intrauterine growth restriction. And I was actually thinking perhaps the Avomin, the Vomitin, played a role in her developing the IUGR.
No, so IUGR means that there's the baby is not getting enough nutrition to grow. That's basically what it means.
Oh,
and so anything that restricts blood flow or restricts fetal growth or nutrient availability is what will cause it. Medications can cause it, but not necessarily so. So things like cigarette smoke, what smoking during pregnancy does is that it affects the blood vessels. And so it constricts, it causes vasoconstriction. So the blood vessels will constrict and there will be less nutrition to the baby compared to if you hadn't smoked. So that's how it will affect it.
Oh, okay. But in this particular case, the baby actually came out all right, but the baby came out with IUGR and also the baby was preterm at the same time. The baby came out at 36 weeks with the intrauterine growth restriction. And along the line, the baby developed bronchopneumonia. And the baby had to be hospitalized for, I think, a whole month or getting to 2 months or so when the baby got better. But after a while, it was discovered she had developed a sensory problem, like you said, as a complication. But initially, we thought the sensory problem was actually as a result of the treatment and the whole lot of antibiotics they gave as a result of the treatment for the bronchopneumonia. But as it turns out, it looks like it's rather a complication for the IUGR.
Yes, you cannot blame the antibiotic. It's an effort to make that has a toxic effect on the hearing. And even that, it has to do if you give it for a prolonged period.
Okay. All right. Thank you.
You're welcome.
Hello, Ghanaians. I come to your homes once again.
Any more questions? Any more questions?
Any other question?
No question. No question, doctor.
Doctor is tired.
Doctor, thanks so much for your time.
All right.
Hello, Ghanaians. I come to your home once
today
again.
the people want us to close early.
Hey, Mama Esther, you want us to close early?
Oh, but if you don't have any question, why do you want to keep Doc on the line?
Fellow Ghanaians, I come to your home once again.
Madam, thank you very much.
Madam, wait.
Please, if you have
Why you
question,
going to conversation?
hello, please, if you're not asking a question, kindly mute your microphone.
Oh, I have
Who has a question?
a submission.
Rabi, okay.
You have a submission because yesterday, Madam told us to.
I said I'll do it on Monday. Today is Sunday.
Oh, okay, all right. Thank you.
Today, Sunday, Madam is preparing a mutu and granite.
I went to work. I haven't cooked anything the whole day.
What causes a bad network?
Oh, let me general. Nkunda want to ask a question. Madam, please, good evening.
Good evening.
Yes, Madam, please, within the explanation where we would have differences in resource factors, you outline certain things that can be there, that can happen as a result. But at times, within the early stages, we see that the pregnancy is flushed out. Why is it that if the mixing of the blood is done during delivery, and that is when maybe the antibodies can be triggered? Why is it that?
But pregnancy loss can be from several causes.
But Madam, the ones that are secondary to resource factors.
No, but are you sure of the blood group of the baby? You wouldn't know.
Okay, Madam. Okay.
So
Okay.
if the pregnancy is lost at the initial stages, there's nothing to show that it is resource incompatibility.
Yes, Madam. Madam, what of known parents? From the parents, known parents say the parents are having opposite.
If the mother has blood group negative and the father is positive, there's no guarantee that all the babies will take the father's blood group.
Okay, Madam. Okay.
So you can only know when you test the baby's blood group. So even though the father's blood group is against the baby, the mother's blood group, it's possible that all the babies will take the mother's blood group and there will be no problem.
Okay, Madam.
That is why when you're taking the gynae history, it's very important to find out if the woman has had a termination of pregnancy before or a spontaneous abortion or a miscarriage before, because that will help you to understand if there's a blood group incompatibility and the woman has had the pregnancy before, then it's possible that that pregnancy might have triggered that antigen antibody reaction. And this baby
already.
Okay. So a previous history of pregnancy loss is very, very important when you are taking the history of a woman who is pregnant.
Okay, Madam, please, I have a follow-up question.
Yeah.
On this. What if the person committed the abortion, let's say before, let's say 3 months or something, like the person willfully committed the abortion, because per your submission is said when there is during childbirth the blood mixes. Let's say
so during abortion too, it can mix.
During abortions.
Yes.
Oh, okay.
Because the abortion is done medically. I mean, if it's being done surgically, it's a scraping of the endometrial lining of the uterus.
Sure. What about if the person took, let's say, some drugs and then the thing came?
So if the person took the drug, she'll bleed. Won't she bleed?
Sure, she'll bleed.
So during the bleeding, that.
Jeff, the way you're interested in this, we should be very careful.
Evans, you had a question. Your hand was up.
Yes, I was trying to ask a question pertaining to what a soldier asked about the testing of the unborn child.
Yes.
And then they have some tests called Kuhn test or whatever. I've heard it before. Madam, I don't know how sure it is.
To test for what?
The unborn child.
No.
The blood. unborn
No,
child.
we don't. Coombs test is not to test for the blood group of the baby. Coombs test is to test whether there are antigen antibodies present in the blood. That's what the Coombs test does, and we don't use it to test for the unborn baby. Coombs test is one of the tests we do when we are evaluating a baby for neonatal jaundice. With jaundice, it means that it's possible that there's some blood group incompatibility which has caused a breakdown of the red blood cells, and you have bilirubin in the blood leading to the jaundice or the yellowish coloration. And so one of the tests that you test is the Coombs test. The Coombs test will tell you whether there is some antigen antibody reaction between like occurring in the baby's blood. And when it is positive, it tells you that maybe you should check the mother's blood group. Maybe there's a possibility of an antigen antibody reaction. It doesn't test the blood group of the unborn baby.
Okay, madam. Thank you.
All right. Any other questions?
iPhone, your hand is up. Unmute yourself and then ask your question. Foster, is that you?
Yeah, it's Foster.
Foster, ask your question. Your hand is up. Foster.
Oh, yeah, okay.
Sorry, the network you're reaching is out of coverage area.
Madam,
Yes.
with this network problem and exams, these online exams, madam, how possible
So I
going
said
to be?
I'll ask HOD about it. I haven't asked him yet, so I don't know.
Oh, okay. Because the network,
And we haven't determined that we'll have exam or the format of it. So I haven't asked him yet.
Mabel, your hand is up.
Nick, I'm okay.
Yeah, okay. All right. Okay.
Madam, please, are we going to continue having a 7 p.m. lecture the whole of this week?
Yes.
Okay.
Great.
All right. Thank you.
Madam is taking us on a ride to Dubai.
So hopefully we should be done by Friday.
Yay.
Okay.
Okay. And then also you were talking about looking at possibilities for clinicals if we can. Yeah.
Yeah, so that's part of the discussion I'll have with HOD tomorrow.
Okay.
Okay. Madam, please, we beg you come with good news.
What the involvement of the school should be. If we need a letter from the school, or we can just put the hospital straight. So I'll ask him and then
Okay.
Okay, madam, please come with good news. We beg you.
I'm not the HOD. I'm not the HOD. I have absolutely no.
That's why you're talking.
I'm giving you warning in advance. I'm giving HOD warning in advance.
I'll put you
he should give you good news so that you bring to us, or else we'll go to the school. My fellow Ghanaians.
I'll bring you news tomorrow.
Okay? All right, Doc. Okay.
Doc. All right, Doc.
Thank you very much.
Okay. Have a good day.
Have a good evening.
You too. Good night. Good night.
Please, today our favorite class noise maker did not come to class.
And who is that?
Akosia.
He's going downstairs. I pretended I'm not hearing her. All right.
All right, Doc.
Good night.
You too.
Okay, bye.
Rabbi, it's so soothing to hear your voice, eh?
Oh,
Rabbi, I miss you like a Matan Popo.
Hey,
Nick.
Why?
Nick.
No, you just when she's asking the question, let me just do a case scenario. When she's asking the question, you just listen to her voice. It's like it's with she talks with modesty.
Sexy. It's very sexy.
I didn't say sexy. Get out.
Dinner.
Man, as if she's written orgasm.
When trouble
Yeah.
is asleep. When trouble is asleep. When trouble is asleep. Then my kind go tap trouble. Trouble I beg wake up.
Forget
Trouble
it.
I beg
No
wake up.
trouble behind
Wake
is
up,
asleep.
wake up.
Forget.
Okay,
No
hold on.
trouble behind is asleep.
Hold on. Let's
Forget
do
it.
let's do an experiment. Let Rabi just make one sentence and all of you listen to her voice.
You see, when Americans
Okay,
and George
Rabbi,
Bush them
yeah.
Oh, General,
when
please keep quiet.
when they were
Nice.
pulling
Nick,
Osama bin
General
Laden,
Kunda, we
they
want to
thought
hear
Osama
Rabi's
bin
voice.
Nick,
Yes.
they thought
Nick.
Osama bin
I
Laden
want
could
to
do
take
nothing
this. I
till
want to
Osama
seize
bin
this
Laden
opportunity.
bombed them.
Oh, soldier. Oh, soldier.
Some people claim to have
Say
developed,
that.
defeated some people, and yet,
I say that.
Guys, hello class. Guys, also to be honest, contribution kakran na buy. It has helped a lot. So me personally, I'm overwhelmed. Say who came out to give their best. Me de medamase. My idea, motivation. Mama camp as a black star motivation is strong. Now what went to Yana Wahano? Shame on to you.
Oh, Nat. Nat, we are talking about Rabi's voice now, not contribution.
Rabbi,
Hey,
your voice.
Assembly.
Over to you, Jolati.
Jeff. Say okwa Bible ma wo. Disciples no so mu didi ane no ote Yesu nchen odi ne tutu Yesu no na yi Yesu ma.
It's one yes I nipa no.
Na je say Nick.
Ne akwasu nyina no wo hu. Na Peter cross odo Yesu. Odina Yesu 3 times. Odina Yesu 3 times. KK for su jana get Reginald Stone jana get my KK for su. So kwa go chaba. I know na odeko boy on kwam ni boko si atafre. I know kwa boy on kwam ni boko si atafre no. Uni baby da mama da bre no. Me say Osama bin Laden is still alive. Timu pese mu bomba mo da mo corona ya left lockdown na outro bomb mo da mo ntumbo.
Bomb you shot yourself in the foot. You shot yourself. Umage broken heart.
I would.
Nipo ben.
I'm a private consultant. And if I'm doing consultation, problem you know, I'm a senior gynecist. So if I'm doing consultation in my consulting room,
so you're doing consultation on them. Now a consultation, no. Consultation now.
Consulting room. So I say.